We're not bionic, we can't fix those things. But just because you've had a replacement surgery and you're still suffering doesn't mean you're not a good candidate. We just have to determine why are you still suffering. And most of the time it's not because there's something that's not intact or surgically wrong. There are a few instances. Most of the time it's because of scar tissue or soft tissue around it that never healed, and your body wasn't able to cope or deal with that, and now we can give it. Absolutely.
So
Yes.
That's fine.
That's
right
you?
there. Because as soon as I had my knee replaced, I had something else. I had torn my Achilles tendon. I didn't get this well.
It
Or
happens.
I had to lay up 6 months.
It happens a lot. We see soft tissue. Yes.
So it will happen.
Yes.
Because it's on each side of the knee. It's on each side.
So it works great with people who have post-op like torn meniscus, and they never healed up, which is common because only about a third of your meniscus has blood supply. So when you have that surgery, it almost never heals right, which is why I wouldn't recommend somebody having a meniscus surgery. I very rarely see anybody that has success with that. But if you did have it post-op, you can do great with stem cell treatment.
So you put that in my knee and it will help with it.
Yeah, we identify where the soft tissue, where the problems are. That's just like somebody comes in with a rotator cuff tear. If the tear is not a complete tear, it's a partial tear. Instead of having surgery, we can do stem cell, and we'll actually see that muscle actually regenerate.
I got that too.
Okay, so
Yes, ma'am.
maybe you're missing something, which could happen for me.
Okay.
Okay, so let's say you have both knees that need to be replaced and you have 2 rotary cuff tears. So that's for injections. Injection is into each, like the cortisone shot was in the knee.
Yes.
So
It will be into each site. That's correct. Now, yes, it would be in each site.
but it doesn't have to be all at once. You can see what it does with the worst part of it. Check with that, go from there, and
Absolutely.
then go further. Right?
Absolutely. So we have that happen all the time. I had a gentleman that did stem cell treatment Monday. He needs it on both knees and a shoulder. Okay, for cost reasons and to see how he wants to respond. He said, well, can I start with one knee, see how I do, and then come back and do my shoulder and knee later? Absolutely. Sure, there's no problem with
So, but
doing
if you
that.
had it in all 4 at one time, would it make maybe crevice it out into the little streets?
Well, the
and
stem
make
cells
it
are
never and
the
never?
stem cells will migrate about 8 inches from wherever we inject it. Now, sometimes if a person has, a chronic illness, a chronic condition, like when we're treating like Parkinson's or MS, that's going to be done not through an injection. That's going to be done through IV, so that we can get it in their entire system. And you got to be able to penetrate the blood-brain barrier, which there's some things that you have to do to be able to get the stem cells in through that. So that's a whole little different. Now, I will tell you, I evaluated a patient. Actually, I was reading through. My wife Michelle's here; she can tell you. So at night, I'm reading through, MRIs and CT scans and stuff. The guy since 2003 has had at least 30 of these things and all these types of procedures. And he has congenital spinal stenosis. So that's narrowing of the spinal canal. And he was born that way, but he's had all these other things. And there are so many areas across his spine. I'm going to consult with our specialist that I work with for that to see if we can applicably do an IV treatment for stem cell with him, because it's so broad-based, to see what kind of result. Because for us to actually inject every single level that he has, first of all, it's not probably going to be feasible. He doesn't have $250,000 for us to do that, but he has $10,000 or $15,000 that we could work with to look at multiple applications through IV to see how he responds. So I just have to take each case by case and try to figure out what's going to be the best approach for each patient. But typically, orthopedic problems are best addressed through an injection right into the area of complaint. Sometimes if we have a shoulder, like I had a gentleman come in and had a osteoarthritis in the shoulder, had a torn labrum, and a rotator cuff. So we actually did 3 different injections, but it's one shoulder. We just put the stem cells strategically at the 3 different places. Still one cost, not 3 different costs. We just put the stem cells in different areas. Yes.
So, like 3 to 12, that's a lot of money. Does you work with payment plans?
Yes, so we have payment options available. We have in-house financing available, so that almost every patient that has elected or wanted to do this procedure, has been able to do it. Not all. I mean, you know, if you don't have a job, you don't have a viable way of having income, and you don't have any assets, I'm kind of stuck. I can't help you a whole lot. But, you know, most of the time we're able to find a way to do that.
Does it regenerate nerves?
Yes, stem cell will regenerate nerves as well.
So I've got nerve damage.
So I have a gentleman that's going to be coming in that had a blood clot, and we didn't have to, but his left foot was amputated a few years back, but he still has phantom pain and nerve damage from where that amputation is. We're going to be doing stem cell in his lower extremity, and I think he'll do quite well.
Is there a bank, a pharmaceutical bank, is it
So that's a great question. So one thing I didn't touch on, if you have children or grandchildren at a childbearing age, and they have an opportunity, now when you go in, you're given an opportunity to actually cryobank or cryopreserve your placenta and umbilical cord. The cost on it's about $5,000. But guess what? Do you know how many applications of stem cells that you can get out of that? It's well worth it to do it, and then you have your own for any problems down the road. Not only your own, but for several other family members. Well, they do now. They didn't, you know, a few years back. They do now because we didn't know the far-reaching applications of those tissues. You know how many placentas and umbilical cords were thrown in the garbage? Oh my gosh, over all these years. But hey, you don't know what you don't know. So we do know now. And yes, you can have them cryopreserved. So the way that we do it is we use a biotech company called Predictive Biotech that actually has harvesting steams that are certified by the FDA, regulated, certified by the FDA, that goes in and do the harvest for us, washes the cells, tests the cells. So that's where all the cost comes in, because even though the materials are donated, there's a large cost. We got to test to make sure that cells are viable. We have to have that done by a third party. We got to get cellular counts, and all that happens behind the scenes before you ever get your procedure.
Are there any side effects?
No known side effects, no known adverse reactions. Although, I will say this, let me backtrack just a second. When I did my knee, there were nights where I didn't really have pain from my torn ACL, just a lot of instability, and then if I was like trying to play basketball or something, even with a knee brace, I'd get the wrong way and then I'd fall to the ground and I was in excruciating pain. But one thing at night, for a while, I'd wake up with my knee kind of like throbbing or aching. It was healing. Okay, so other than that, no.
Did you do your own?
No, I didn't inject my own. I had somebody else inject it. That'd be kind of hard. I guess I could, but it'd be kind of hard. Yes.
I have a family who had neck surgery, and it was supposed to have been osteoarthritis.
Yes, ma'am.
Well, they couldn't so,
Is everybody hearing this, by the way? Can you speak up? Can I get everybody's attention? I want everybody to hear this, because when I go over the risk of surgery, sometimes I get eyes rolled. But I'm telling you, being in practice 17 years and seeing this over and over and over and over again, anytime you go under the knife, you are taking a risk. Would you speak up and tell this story?
I have a family member who went into surgery, neck surgery, for osteoarthritis bone spur, which was supposed to be taken off. That's what he said he had back there. So he cut into his spinal cord in 3 places. And so he was left with a condition called Brown-Séquard syndrome, where one side of the body would have sensory perception but no muscle control, and the other side is just the opposite. And he has had chronic pain on the side that he can feel up there. We actually had to go to Vanderbilt to have, I don't know what they put in there, except coral and I think some metal too, just so he could hold his head up. And so that was 03. He's been in chronic pain ever since then. You know, he was an avid hunter, golfer, fisher. He can't do anything. So would he possibly be a candidate?
Absolutely.
I don't know how much metal he has.
Absolutely. You just got to determine whether we can get to the site effectively or not. That's the question, depending on how much hardware is there.
But nobody told us that been any of risk. We were supposed to be back to work in 2 weeks.
like nothing ever happened.
And I'm sure that was the intention. But that is the risk of going under the knife.
Yeah.
You go in and you don't know how you're necessarily going to come out. Which is why 50%, roughly 50% are going to need additional surgery.
I think we were just a statistic, but it's still messed up.
Still a statistic.
Real bad.
Yeah, and I see that over and over again. And if you actually ask most of your practitioners, your primary care, your nurse practitioners, your physician assistants that are out in the field every day, not the orthopedic surgeon, but you ask the people that see these people every day, and they'll tell you the same thing I'm telling you. It's a risk. It's a risk.
Your procedure is actually maybe 5-10 minutes. Get on the table, talk about it, and
Yeah, the ejection procedure itself is, the physical evaluation and any diagnostic test that's needed. Like if somebody comes in with a rotator cuff problem, they haven't had an MRI in 5 years, they need to get an MRI. I need to know where to put these. But yeah, that's the longest part of the visit. The injection procedure itself, most of the time, depending on where it is and what needs to be done, sometimes take longer than 5 or 10 minutes. A knee's pretty easy. If we got to do a hip, that's a little bit more difficult. Spine, certainly we got to do under imaging most of the time. So, yeah, so you're looking at knees take about 10 minutes. A spine, depending on what we got to do, could take 30 minutes. But this is not stuff you're under treatment all day. I mean, you're in and out mostly. When we do the PRP injection, we got to spin your blood down for about 30 minutes. So you draw your blood and then you're just hanging out for a little bit. What's that? Yeah, you should have got some. We'll get you some. Maybe. Yeah, okay. I'll get my staff to get you some. Yes, ma'am?
Yes, I have Parkinson's. My neurologist told me she thought I was a viable treatment for Parkinson's.
Okay.
Because the regeneration keeps going on. They can't stop it. So it results like in the other side effects like tumor.
That's just not. No, I've seen Parkinson's patients with intention tremors within 30 minutes of getting an IV stem cell treatment, all their intention tremors be gone.
When you said the short term was good, it was the long term.
Yeah.
That it was concerned about.
I think there's a lot of quote unquote horror stories that are just not accurate. Like one of the most recent ones about stem cell was somebody using stem cells to treat the eye, okay, for like glaucoma, and the person went blind. Well, it wasn't the stem cells. It's that the individual provider doing the stem cell treatment, where they placed the needle is what blinded the patient, not the stem cells. So, you can't do, and then why you would do both of them on the same day, you got to be kind of dumb. I'm just sorry. You can't be real smart as a provider to understand that if you're dealing with somebody's eye, you ain't going to do both in the same day. I mean, it just, so some of the things you got to understand are, hey, anybody ever went to a good mechanic? Anybody went to a bad mechanic? Anybody went to, or do you think they're good police officers that are not crooked? Do you think they're bad police officers that are? So guess what, guys? They're good doctors, and there's not so good doctors.
That's right.
And so, I think I'm pretty good. But,
I think you have your badge to the bone.
all right.
what made you become a doctor? Your last name?
I actually had a real bad neck injury playing football when I was in high school. And I spent 3 years suffering, lost use of my right arm, had migraine headaches every day, and I got all that resolved, and so that's what made me passionate about becoming a doctor and helping other people. Because I knew what firsthand what suffering was like, and no one was giving me answers, and I went to every doctor under the sun, and so when I finally got help, it motivated me to become a doctor.
So are you actually a primary care physician, or are you just?
No, I'm actually a chiropractic physician, not a primary care physician. Okay. So in our office, we have an integrated office where we have all types of providers. I'm just the owner. Okay.
Now, I don't take any prescription medicine. They try to put me on all kinds of medicine, but I won't take it.